My name is Arianna Resendiz, and I am a Master's of Public Health student in the Health Behavior Health Promotion concentration. The title of my internship is Qualitative Analysis of Hispanic Women's Perspectives on a Culturally Appropriate Weight Management Program at El Rio Health. I completed my internship at El Rio Health Center, which is a nonprofit organization that has been providing services to people in Tucson since 1970. In 2016, El Rio served approximately 94,000 patients, with the majority population being 53% adults, 58% women, 64% Hispanic or Latino, and 55% insured under Medicaid, otherwise known as Access. The mission of El Rio is to improve the health of their community through comprehensive, accessible, affordable, quality, and compassionate care. I specifically worked with the Weight Management for Optimal Health program, which is a medical 12-week program that is offered to patients and employees with a BMI of 27 or higher in conjunction with a health condition or a BMI of 30 or higher. The program meets once a week for 1 to 2 hours, and the participants meet with their provider every other week. Weight loss medication is an option, and the participants learn about nutrition, physical activity, stress management, mindfulness, amongst other topics. The goals for the participants are to lose 5 to 10% of their body weight and maintain long-term, which will then help manage sugar levels, HbA1c, blood pressure, and improve overall quality of life. The goals of my internship were to evaluate the current program in order to identify areas of improvement and elicit perspectives on how to create a culturally competent program for Hispanic women. Also, to gain an understanding about Hispanic women's attitudes, barriers, and motivators for weight management. Through my literature review, I found that more than 2 in 3 adults are overweight or obese in the United States. Moreover, Hispanic women have an obesity prevalence rate of 45.7%, having the second highest rates, with African American women being number 1. The reason why Hispanic women were the target population for my internship is that they have the second highest obesity prevalence rates. They are the predominant population that is served at El Rio. They are highly underrepresented in culturally competent programs, and a successful weight management program for Hispanic males already exists. Additionally, weight loss interventions that are designed for the general population are usually unsuccessful among ethnic minorities for various reasons. A few being that the content is not relatable to the population, or the direct translation oftentimes does not make sense. Therefore, it is important to take into account various factors in order to make a program truly culturally competent, such as literacy levels, Hispanic values, traditional beliefs, and others. To carry out this project, I developed interview questions, created a questionnaire that focused on demographics, recruited 20 overweight or obese Hispanic women, 10 were past participants of the weight management program, and 10 were Spanish-speaking women waiting for the Spanish program to be created. I then conducted the interviews, transcribed them, and qualitatively analyzed them to determine themes. For my demographic results, the average weight was 209 pounds, BMI was 37.8, years in the U.S. was 37, and 10 of the Spanish-speaking women were foreign-born and of Mexican descent, specifically from Sonora, Mexico. Additionally, 40% of the women I interviewed did not have a high school diploma. The first overarching theme was attitudes about weight management, with the first subtopic being familial experience of chronic disease. The women connected weight management with chronic diseases amongst their family members. They specifically discussed how type 2 diabetes is prevalent in their family. The second subtopic was traditional food perceived as unhealthy. When I asked the women to name a healthy dish, most had difficulty doing so. However, the ones that did name one said that cocido was healthy, which is a beef soup made with many vegetables. The second overarching theme was barriers to weight management, with the first subtopic being lack of support from husband or spouse. The women mentioned that some of their husbands are controlling and do not let them go out to exercise on their own. Additionally, some are blinded by the concept of obesity and do not see it as a problem. Therefore, they do not support the women when trying to make changes. The second subtopic was perceived cost of healthy foods. The women mentioned that healthy food is expensive. However, once they learn when and where to purchase groceries, the burden lessens and eating healthy becomes more manageable. The third subtopic was culture and the role of family in food. The women discussed how family gatherings were often a barrier because there is always a lot of delicious food, which is oftentimes unhealthy. They also discussed the disconnect between culture and exercise. One particular woman said that she was intimidated of going to the gym because there were oftentimes skinny women in yoga pants, so that made her feel uncomfortable. The fourth subtopic was role as a Hispanic woman. The participants discussed that Hispanic women have very busy lives. Most of the women that I interviewed were stay-at-home wives, but they were oftentimes taking care of children or grandchildren and doing household chores, which left them with limited time to take care of themselves. The women also mentioned that nowadays, some women work, which means going to work and coming home to do all of the household chores as well. The third overarching theme was motivators for weight management. Overall, the women were motivated by seeing results amongst themselves and their peers, having a positive body image, and being healthy in order to manage comorbidities and live a good quality life. The last overarching theme was recommendations for a culturally appropriate program, with the first subtopic being information based on cultural practices and values. These recommendations come from both the interviews and my literature review. For the first one, I recommend that El Rio tailors their program to people of Mexican descent, specifically traditions and food from Sonora, Mexico, since in the demographic results we saw that all of the Spanish-speaking women were from Sonora, Mexico. Next, I recommend that El Rio incorporates the theme of familismo, which means the importance of family, as a main theme in their curriculum, because as I previously mentioned, family gatherings and such were a barrier for some of the women. Therefore, teaching them how to navigate things like that is of importance. Next, it is important that accurate food measurements are not used in the nutrition portion of the curriculum, because through my literature review and through personal experience, I know that food measurements are rarely used. As a matter of fact, a big spoon and a little spoon are usually used to measure ingredients. Lastly, I recommend that El Rio creates their program materials appropriate for people with low literacy skills, because through the demographic results, we saw that 40% of the women I interviewed did not have a high school diploma. Therefore, low literacy may be a factor. The second subtopic is family-based programs. There was a great reception to this idea. The women mentioned that a program like this would encourage all of the family members to have the same goals of losing weight. Therefore, it would be easier to manage daily meals. One woman in particular mentioned that she sometimes had to cook 3 separate meals because not everyone in her family wanted to eat healthy. The women also mentioned that it is important to start teaching children about nutrition and exercise at an early age in order to prevent diseases in the future. The third subtopic is group sessions. The past participants enjoyed the group sessions and recommend we keep them. They loved the peer support, and it helped them realize that they are not alone in their journey of weight loss. The fourth subtopic is recruitment strategies. The women recommend that we motivate women to join the program by showing that the program works, such as showing before and after pictures of actual El Rio patients. They also recommend that past participants work as champions to recruit other patients. The last subtopic is concerns with medications. There was a split decision with this one because most of the past participants took weight loss medication and said it was a needed boost for weight loss. However, the Spanish-speaking waitlisted women had negative connotations with weight loss medication because they identified it as not being a behavior change and may lead to other health problems. Overall, this internship allowed me to gather qualitative data on a population that is highly underrepresented in weight loss interventions, and the results will benefit the development of a culturally appropriate program, which is lacking. There were some limitations to this internship experience, such as the results not being generalizable since the population was so specific. There may be bias in the data since I was the only one analyzing and interpreting the interviews. And lastly, acculturation could be a factor because, as I mentioned previously, the average years in the U.S. was 37. Therefore, I interviewed a highly acculturated group, and it could skew the results on how to truly create a culturally appropriate program. Some barriers were also present, such as scheduling. I had to conduct some interviews over the phone due to scheduling and time conflicts. Therefore, I recommend that El Rio conducts further interviews or surveys in order to identify the best time of day to provide the program. Overall, this internship was very useful in my profession as a student and as a public health professional. El Rio allowed me to exercise various skills such as interpersonal skills, interviewing skills, and qualitative analysis skills. In addition, they gave me independence when carrying out this project. This was a phenomenal internship experience, and I learned that working with underserved communities and improving their quality of life is my passion. I would like to thank my committee chair, Dr. David Garcia, my second reader, Dr. David Marrero, my preceptor, Diane Hager, the Western Region Public Health Training Center, El Rio Health, the interviewees, and my husband and parents for all of their love and support. Thank you.